All right. Hi, my name is Mackenzie. I'm a clinical nurse specialist student and I'll be doing your assessment today, Mr. Korsh. Could you please tell me that your preferred name and pronouns before we get started?
Ian, he, him.
Thank you. All right, Ian. I've washed my hands before this assessment. So we're going to do, again, like I said, a full assessment. Do you have any concerns that you'd like to address during this appointment?
Mm-mm.
Very good. All right, so I'm going to start with your head and we'll work our way all the way down to your feet. All right. So Ian appears to be a 33-year-old healthy male in no acute distress, calm, cooperative, breathing appears to be equal bilaterally. All right, we'll get started, Ian. So I'm going to start by feeling your head and looking for any lesions, bruising, or concerning moles. All right. The hair pattern appears normal and equal throughout. There are no lesions or bruises, and head is normocephalic and atraumatic. All right, Ian. I'd like you to open your mouth for me. Stick out your tongue. Great. All right. Dentition appears good. No decay. Tonsils are intact bilaterally and no swelling. Uvula is midline. Tongue is midline. Could you say ah for me? Very good. Oral mucosa is pink and moist. All right. Now, Ian, what I'd like to do is palpate your lymph nodes. Any concerns there for you?
No.
Great. I'm going to name them as we go. All right. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical, and supraclavicular. Very good. Any pain with that?
Nope.
And no swelling felt on exam. All right, Ian. I'm going to assess your eyes now. What I'd like you to do is follow my pen light in each direction I put it with only your eyes. Ready?
Mm-hmm.
Great. Extraocular movements intact. All right, Ian, I'm going to have you look straight ahead at the door there. And I'd like you to continue looking straight ahead. Do not look at my light. Are you ready? Great. All right. Pupils are equal, round, or active and accommodating to light and accommodations. They are 4 millimeters constricting to 2 millimeters. All right, Ian, I'm going to step behind you. I'd like you to actually lift up your neck right now and swallow for me. Great. Trachea appears midline. Could I hand you your water? Take a small sip. All right, and swallow for me. Great. And another small sip. And swallow. Great. No swelling felt on palpation of the thyroid. All right, Ian. Now what I'm going to do is a whisper test. I'm going to stand behind you and have you cover one ear. I'll whisper 3 words and I'd like you to repeat them back to me. All right, you can cover your right ear. Slipper, purple, blue.
Slipper, purple, blue.
Thank you. All right, cover your left ear. Fork, bird, yellow.
Fork, bird, yellow.
Great. Thank you very much. All right, Ian. I'm gonna listen to your posterior breath sounds and just adjust my camera. All right. As I move my stethoscope, I'd like you to take a breath in for me, okay?
Okay.
Great. I'd like you to say E for me.
E.
Great. Posterior breath sounds are clear and equal bilaterally, negative for egophony. While we're here in this posterior position, I am going to evaluate the CVA tenderness. And I'm going to do a little pounding on your backside. Please tell me if there's any pain, okay? All right, feeling the 12th rib. Any pain?
No.
Okay. Any pain?
No.
Good. All right, now I'm going to adjust my camera. All right, now I'm gonna listen for your anterior breath sounds. Again, take a breath as I move my stethoscope. And please turn your head that way for me. Thank you. Great, lift up your left arm. Great, and lift up your right arm. Excellent. Breath sounds anteriorly are clear and equal bilaterally. And now I'm going to move on and listen to your heart sounds. I'm first listening with the diaphragm. I'm feeling for the second intercostal space on the right sternal border. Excellent. Now, Ian, what I'd like you to do is lean forward for me and blow all of your air out. Great, you can breathe. All right, S1 and S2 heard without gallop, and no aortic murmurs heard. Ian, what I'd like you to do is go and position yourself by that green flower pillow. And if you could start by laying with your elbows up at a 30-degree angle.
You need to adjust your camera.
Oh, thank you. All right. I'm going to assess for jugular venous dissension. Please lift your chin up for me. Excellent. No jugular venous dissension found. All right. Now I'd like you to lay on the left side. And I'll be placing my stethoscope at the fifth intercostal space, mid-clavicularly. All right, you can lay back on your back. S3 and S4 not heard and no murmurs heard. All right, Ian, I'd like you to switch positions and actually lay with your head on that white pillow right there. All right. Any concerns with your abdomen, Ian?
No.
All right. And are you comfortable in that position?
Yep.
All right. You can put your legs up with your knees bent if you'd like. All right. And I'm going to be covering Ian up for his comfort. And Ian, could you please lift your shirt up for me? Excellent. All right. Ian's abdomen is flat, non-distended with no obvious pulsing. Skin from head down has been clear, warm, and dry with no lesions, bruises, or concerns. All right. I'm going to start by listening to your bowel sounds, Ian. All right, bowel sounds are normal, active in all four quadrants. And now I'm gonna listen for any bruise in your arteries. Aortic. Renal. Iliac. And femoral. No bruise hurt. Alright, and now I'm going to percuss. And you can put your legs on if that's more comfortable for you. Dullness heard in the left lower quadrant, tympani, and all other quadrants. Alright, and now I'm going to go ahead with some light and deep palpation. If there's any discomfort, please let me know. Great, no masses felt upon light palpation. Deep palpation now, Ian. Please let me know if there's any discomfort or pain. Excellent. All right, no masses felt. All right, I'm gonna uncover you and I'll have you sit at the edge of the bed here, Ian.
Mm-hmm.
Let me know if you need it. All right. Do you feel dizzy at all?
Nope.
Very good. All right, Ian. What I'd like you to do is just move your head and neck side to side for me and up and down. Any pain or discomfort?
No.
Great. Can you stick out your arms? I'm going to feel for your radial pulses. Great. Radial pulses are +2 and equal bilaterally. All right, put your arms out like this. Don't let me push down and don't let me pull up. Great. And like this. Don't let me pull. Don't let me push. Great. Strength in the upper extremities bilaterally is equal. All right, and I'm going to take off your shoes. And I'm going to feel for your peeled pulses. Any numbness or tingling anywhere, Ian?
Nope.
All right, pedal pulses are +2 and equal bilaterally, and there's no swelling on the upper or lower extremities. Skin again is warm and dry without lesions or bruising. All right, and I'm gonna push. Don't let me push down on your feet. Great. Don't let me pull up. Push out towards my hands. Great, and don't let me pull up. All right, and I would like you to move both of your arms. Any pain or discomfort?
Nope.
Great, and same with your legs. Just lift them up for me. Great. Any pain or discomfort?
Mm-mm.
Good. All right, now what I'm going to do is test your patellar reflex. Just relax.
Mm-hmm.
Great, and I'd like you to hold your hands like this. Excellent. All right, patellar reflexes are equal bilaterally. Great, you can relax your hands. Now, Ian, I'd like you to stand up and close your eyes. All right, Ian's closed his eyes for 20 seconds. Now, Ian, I'd like you to walk back and forth in the room here, and I'll follow you with the video. Great, you can have a seat, Ian. All right, gait is equal bilaterally, and Romberg is negative. All right, and Ian, do you have any questions for me before we get finished here today?
Nope.
Excellent. I'm going to go formulate a plan of care for you, and we'll talk through next steps and some health promotion techniques.
Okay. Perfect.
Thanks for your time.
Thanks.